Welcome to The Seasoned Sonographer, the podcast where experience meets education in the world of OBGYN ultrasound. My name is Lynn Flam, and I'll be your host. I'm a registered diagnostic medical sonographer with over 32 years of experience, most of that time in OBGYN ultrasound. Through this podcast, I'm here to share insights, tips, and case studies to help you sharpen your skills and optimize your scans. Whether you're just starting out or you're a seasoned pro, this is the place to grow your knowledge and confidence. Let's dive into today's episode. Welcome to The Seasoned Sonographer. I'm very excited today because we have a guest. Megan Walker is here with me, and she's a certified nurse midwife. She's here to help us understand the impact that second trimester anatomy scan has on her practice and her decision making. Welcome.
Hello.
So, Megan, can you give us a brief description about your education and work background and how you got where you are today?
Yeah, sure. So I became a nurse right out of high school. I went straight into college knowing that I wanted to be a nurse, but I had no idea what type of nurse I wanted to be. So I got a job initially working med-surg, and then I found myself interested in labor and delivery. So I started as a labor and delivery nurse a few years into my nurse training, and then I worked as a labor and delivery nurse for about 10 years. And during that time, I saw a lot of people have beautiful births, and I thought that I could do more. And so as a newer nurse, I had a lot of support from the physicians and some other midwives, and of course all the nurses. And it really made me want to go back to school and get an advanced degree in nursing. So I decided midwifery was the best track because labor and delivery became my love. And I went to nurse midwifery school at Frontier Nursing University, and I've been doing this now for about 9 years here in Southern Illinois.
Oh my gosh, that's awesome. That's so awesome. Well, thank you for coming on today. Yeah. Let's dive into the topic. From a midwife's perspective, how crucial is the second trimester anatomy scan in managing the pregnancy?
So for us here in Southern Illinois, we have limited resources. So it is very crucial for us to be able to identify problems early on so we can manage high-risk pregnancies appropriately. We have, our contacts with maternal fetal medicine and the specialists, but those people are coming from St. Louis or Cape or Springfield, or, people are having to travel to see them, 2 hours and more to reach these things. So it's really important for us to be able to get a good look and get those people where they need to get to for delivery. And of course, high-risk antenatal care and high-risk pregnancy care if that's what's needed.
Right, exactly. And it saves lives when you can triage those patients to the right facility to deliver with the high-risk team on staff there. How do you explain the purpose of this second trimester anatomy scan to your patients when you're saying, okay, so at your next visit, you're going to have the second trimester anatomy scan, and this is what's going to happen? How do you explain that?
So simply put, I tell people we're looking at the parts. We're looking at all of the baby's body parts. We're checking the fluid and the placenta, and we're checking the growth, and we're looking at the organs, the brain, the heart, the kidneys, the sex of the baby, if that's something that they want to know, although, that's completely optional. So really it's about, checking the baby out overall.
Yeah. Checking all those organs and checking the size and all the things. Because most people I'm finding already know the gender of the baby before they even come to me in ultrasound because of that early free cell DNA testing. What are some of the key findings that you rely on from this ultrasound to guide you through the patient's care?
So I mean, it's easy when we have a normal anatomy where everything looks intact and the growth is normal and the placenta is normal. Then, a lot of those people are going to be low risk pregnancies. And we can say, yep, this is a great place for you to be in Carbondale, working alongside with a midwife. And, we anticipate, little problems. But it's key for us to identify if there's heart and abnormalities for the baby. Some of those babies might require surgery and may need to be delivered, in St. Louis or at a higher level of care. There's some findings sometimes that might be concerning for congenital anomalies or even chromosomal anomalies. And so we might need to follow up with them after delivery. And so we might have to schedule them with specialists after delivery. And so it's nice when we know that, so we know, what
Right.
exactly is going on and if they need more hands on deck.
Right. Knowing in advance is key.
Absolutely.
What are some examples of ultrasound findings that might change the course of care for the patient? What are some of the big things that would trigger that change of plans?
Yeah. So heart defects are huge. That's probably one of the biggest things that we're looking at the 20-week scan. Some of those will just require additional scans or maybe even a specialized fetal ultrasound to look at the heart specifically. Placental abnormalities sometimes will require a delivery like with a C-section potentially. So we like to know, that might change, your plan of care. So that's concerning.
Yeah.
And then of course the baby's growth, things
Right.
like that might change our, our care if the baby's growth is not what we were anticipating.
Right. Just any abnormalities
Yeah.
that would need follow-up or a complete change in the plan.
Yeah.
When you receive an ultrasound report with unexpected findings, how do you talk to your patient about it? What's your approach in counseling these patients if an anomaly is detected or if their baby's exceptionally small? How do you go about that?
Yeah. That can be challenging because a lot of these people are going to need additional tests or a follow-up ultrasound. So sometimes when we're doing screening tests, we say like, this is what I believe might be happening. But we need more to really diagnose you with, these certain conditions. So I think going in, just telling people that we're here for them. We have a great crew of people that are there to support them. We have case managers that are able to help people get to other appointments if they need help with like transportation and travel. Because we are working with maternal fetal medicine, we're usually able to talk with the specialist. I can call and make a emergency consultation if need be and get people in with a specialist very quickly. So I think sometimes when I give them news that something could potentially be abnormal, then it's very scary to think I'm going to have an additional test and it might be weeks away. But knowing that I have contacts and we can get people in typically very quickly, I think that's also very helpful. But I think just being there for them and listening and trying to get them as much information I can about the possibilities, of what exactly is happening so they have more information to process.
Right. So do you find that the ultrasound information helps empower the patients in their pregnancy journey, or do you feel like it causes more anxiety?
Probably
most people
both.
want to know.
Probably both.
Most people want to know. They want you to be honest.
Sure, absolutely.
And of course you are. Yeah.
I think it's good to empower them to say, okay, I need to make these decisions and I need to see these specialists, and knowing what's going on, I think is very powerful to them so they can make decisions. I mean, yes, it's very stressful, but I think most people would want to know, well in advance, so that way they can, make the best decisions.
And we have Google and people look things up and they educate themselves. And so they are empowering themselves a lot of times.
Yeah.
How do you work with the sonographers here to ensure the best imaging and accurate reporting?
So for our ultrasonographers, we have them available most days, and usually we're putting in our notes that they need specific scans, anatomy, or if we have a concerning area, we might say, hey, this one needs to look at the heart again. So we're placing orders, and then of course we're always in communication with the sonographers about what we're looking for, so that way they've got an idea on, if there's a targeted area they need to, pay special attention to.
Right. And then a lot of times too, you'll come to me if you see a patient on
Yeah.
my schedule and say, hey, this is
Yeah.
the deal. This is what I'm specifically looking for. So
Yeah.
that's awesome. When do you refer to MFM based on the second trimester findings? Just any abnormality, or do you always follow up first and then send them? How does that work?
Well, it really depends on what the abnormality is. Some abnormalities just need, repeat scans and monitoring. Sometimes they just need additional blood work, and those are things that we feel we can get done in the office. So still might be an increased risk for some problems later on, but not something that needs to see a specialist right away. Other things need to be sent to the specialist very quickly, so that way people can really get a grasp at what's going on with their pregnancy and their baby to make decisions about, what's best for their family.
Right. So what challenges do you face when interpreting those ultrasound reports and discussing them with the patients?
Yeah. So the biggest challenge for me is I am a nurse midwife. And so I'm not trained in ultrasonography. I'm not a radiologist. I cannot read them. So my experience with those has been hands-on and working with the midwife, or working with the ultrasonographers, I'm sorry, and really relying on them to help me see the abnormalities. And of course, we have physicians and we have the radiologist and we have those other people that are actually reading them. But I think that's the biggest challenge for me is I can't read them myself. And so I'm relying on other people to help me get the necessary information.
So how do you balance the midwifery model of care with the increased reliance on technology like ultrasound? Because a lot of times the midwifery philosophy is hands-on and less invasive or technological, if you will.
Yeah. The midwife practice and philosophy is definitely to be there for those low risk patients. In Southern Illinois, we try to meet people where they are. And, we're seeing everyone, high risk pregnancies, low risk pregnancies, and we have the availability and the knowledge to be able to help these people, get where they need to be. And so in Southern Illinois, we have a high risk of high blood pressure and diabetes and obesity and things like that. So I think it's important, even as a midwife who specializes in low risk, but also being able to provide high risk people with good care, so that way they get what they need locally and they get to the people that they need to get to,
Low risk, in a rural area that's underserved,
right,
is not so much a thing,
right. And that's also a midwife philosophy too, is to be able to get people access to care in underserved populations. So that's definitely what we do.
Right. So have you noticed any technological advances in ultrasound that are impacting your practice? Any?
Yeah. So since I've been in practice, and of course, since I've been working as like labor and delivery, just the changes with what we can actually see and the quality of the images and all these scans that we're doing where we get these really detailed looks of the face and these 4D images. I mean, that's all been, since I've been a nurse. So that's pretty exciting. And then I know there's more changes in the future, to ultrasonography too, which are, exciting.
Right. So that brings me to my next question. How do you think AI assisted ultrasound might change midwifery care in the future? And do you see yourself using ultrasound personally more, bedside, or incorporating that into your practice since you would have some AI assistance?
I think we still have to be very careful with AI assistance. I think we need good images and we need people that have that experience to be able to get these good images, and these radiologists, these ultrasonographers that have, the knowledge to really take a good look at these babies. But the possibility of being able to do some potential like bedside scans myself and check the fluid or the growth or things like that. That, I mean, that might be beneficial in, some scenarios. So it's exciting to see where it goes and, what we'll be able to do in the future with ultrasonography.
Right. It is very exciting. So to the sonographers listening, I just want to say you can really see the impact of what we do, the measurements and all the anatomy, and the preliminary report has a huge impact on how these providers, nurse midwives, physicians, PAs, other nurse practitioners, it makes a difference in how they practice, how they handle the pregnancy, and what happens, as far as delivery plan. So what a big impact we do have on the practice. So thank you, Megan, for
You're
joining
welcome.
me today. I
Thank you
really
for having me.
appreciate your time.
Thank you.
Thanks
It's
so
fun.
much. It was fun. Thank you so much for joining me for this episode of The Seasoned Sonographer. If you're interested in improving your OBGYN ultrasound skills and learning more about the field, make sure to subscribe to The Seasoned Sonographer on Apple Podcasts, Spotify, and YouTube. You don't want to miss any of the upcoming episodes. You can also connect with me on Facebook and Instagram at Sonotechniques Academy. Explore more educational resources on the Sonotechniques Academy app or reach out via email, lynn@sonotechniquesacademy.com. I'd love to hear from you. If you have questions or topics you'd like for me to cover, feel free to reach out. This podcast is for you, and I want to make sure I'm covering the topics that matter most to you and to the ultrasound community. Until next time, keep striving for excellence in your scans, and I'll see you in the next episode of The Seasoned Sonographer. The information provided in this podcast and any accompanying materials is for educational and informational purposes only. It is not intended as a substitute for professional medical advice.